Let's talk about another problem that can occur, which is near drowning. So you've heard the phrase, you can drown in a teaspoon of water, right? Well, that's true. Oftentimes drowning is really just laryngospasm. Your larynx can spasm when you inhale water over it rather than swallowing properly. So if you had a bad luck with your regulator, or your regulator fell out and you took a breath of water, your larynx can go into spasm and block you from being able to breathe, even if your lungs aren't full of water. Then by the time you get to the surface, if someone assists you, you may have gone unconscious because you aren't able to breathe. So that's a form of near drowning. Some things to remember about drowning or near drowning. If the person's unconscious and not breathing on their own, initiate CPR and rescue breathing, oxygen. A lot of times at the scene, this will allow the person to wake up and they'll be okay. Also remember that cold water can preserve brain tissue and other tissues a long time, even if the person appears to be dead or near dead. So you've probably heard the expression, if you drown in cold water, you're not dead until pronounced that by an emergency department or a medical professional. And that's absolutely true. So if a diver came up and appeared to be lifeless, you couldn't feel a pulse, was not breathing, even if the diver was blue, and especially if the diver's in cold water, you should always continue efforts for a prolonged period of time and give that person the benefit of the doubt. Of course, we should probably do that anyway, unless it's just a ridiculously long situation away from any help. So those are some things to think about diving. I've had divers with near drowning experiences. They came to the emergency room. We weren't sure if it was drowning or if it was an arterial gas embolism. Had them ready to go into the chamber to treat for a cerebral arterial gas embolism, and then the diver woke up and their neurological exam normalized, and so we actually didn't treat the patient. We just admitted to the hospital and watched, and the diver was fine, thank goodness. So near drowning itself, just not breathing, asphyxiating, is not a specific reason to put the patient in the chamber, but if we don't know exactly what happened, they probably would get treated in case it was a gas bubble in the brain. So those are three things that are emergent conditions that don't indicate hyperbaric oxygen chamber treatment. So I'll stop there, and the next part of this we'll move on to non-emergent things that can happen underwater that fall under the realm of undersea medicine that you should be aware of.